Hey everyone, on today's episode of The Mayor's Table, we have Estevan Rodriguez with Presbyterian Medical Service. He's here to talk about the campus of care and what we're doing to address addiction and mental health crises here in the Four Corners. Stay tuned. Hey everyone, welcome to the Mayor's Table. Farmington Mayor Nate Duckett, and with us today is a first-time guest of the show, Estevan Rodriguez, who is our administrator over the JIP, Joint Intervention Program, the Sobering Center, and the Expansion, as we call it, which is all a part of our campus of care. And Estevan, welcome, man.
Yep, thanks for having us, Mayor.
Yeah, no, it's great. Been wanting to have this conversation for a while because I think it's important that the community know what exactly the city, the county, the hospital, Presbyterian Medical Services, what are we doing to address some of the addiction issues that we see here in our area? And it's a really important program and something I want folks to share this, obviously, because we need to get the word out there that we are doing a lot. And there's a lot of organizations who are partnered with us in these efforts to help address the things that we're seeing and have historically seen in this community for a very long time when it comes to addiction. So glad you're here.
Yep.
Yeah.
Thank you.
So as the administrator for the Joint Intervention Program, Sobering Center, and Expansion, kind of give us what the vision is behind what they do there, what we call the campus of care.
So Totah itself started in 2001. It was initially on its own and then slowly got picked up under PMS. Joint Intervention Program and Expansion and the Sobering Center came a few years later. So what we want to do is obviously work together within the campus, get them into services,
Sure.
whether it's court-ordered or voluntary for JIP, or maybe they're utilizing the expansion to stay over to sleep or to sober up at the Sobering Center. Our staff are encouraged to encourage them, what is it you're needing? And we're hoping as they're exiting, that they come across the campus to the other building and see where they're needing the help. They can
Sure.
get an assessment and then go from there.
Let's kind of break it down a little bit. So Totah started in 2001, and what exactly do we do at Totah Behavioral Health?
So Totah Behavioral Health is an outpatient treatment. We also differ as we have culture, Native American activities, or not activities, services
Sure.
that are available. We do have the Hogan on campus that can be used for some minor
Kind of ceremonial?
ceremonial, and we do the groups in there, and then of course we have the sweat lodge as well that's utilized by the men and the women that attend those services.
So Totah, is it court ordered or is it both? You come in or is it court ordered?
So both. We can take court ordered, we can take referrals, just walk in, somebody, I need help, come in. We encourage everybody to fill in the packet. It's the same packet, try to keep it simple. And then from there, we're like, okay, what is it that you're needing? Is it now housing? Is it certain treatments? What groups do you need to be in? We are fortunate to have 20 groups that we offer from Monday through Friday that they can take advantage of that are available.
Kind of support groups,
yes,
treatment groups,
addiction, men's groups, talking circle,
Okay.
DBT, and then just want to expand as we know not everybody's the same. So we have cultural, and it's not just Native Americans that take those groups. We also have faith-based groups that are available because we want to reach them. We have art groups and just try to vary it because, like I said, we try to reach them where they're at and see which one they connect to.
Sure. I mean, is it specifically for individuals who are dealing with alcohol addiction issues, or is it broader than that?
Broader. Nowadays we have coexisting substances they use, whether it's alcohol, drugs, both, maybe misuse of medication, and then along with that we have mental illness.
Sure.
Sometimes it's all the above.
Yeah.
So we try to do, like I said, kind of check where they're needing to be, what service they're needing specifically.
Okay. So if we go back and kind of look at the history of kind of what we were doing prior to Joint Intervention Program, the Sobering Center, we had Four Winds, who was contracted at that time to hold individuals who were intoxicated We then shifted in 2013, I think the pilot program started for the joint intervention program. And the sobering center part that's played in there, the sobering center is a totally different model than how we've been doing it in the past. Individuals freely can come in. They can stay for, I think it's 11 hours.
Yes.
And then they have to leave. But now, of course, we have the expansion shelter, as we call it, which replaced the roof, which was our winter shelter that was downtown. But now, again, with this campus of care component, if somebody is intoxicated, they can be picked up by the ARU. They can walk in on their own. They can get basically screened right when they come into the sobering center. Is that right?
That's correct.
They can stay there for 11 hours. They can sober up, but we also have the night shelter. So somebody could also transition into the night shelter because that's not open. What time of day does that open up at?
It started at 7 p.m. to 7 a.m. And then last year we had a few days that were super cold, so we were able to run it for 24 hours for 4 days.
Okay.
And then since then we started taking them at 5 p.m. That way, if they were leaving the lobby of Totah, they could just walk on over the campus, check in at 5 p.m. They can stay there till 7. Our office is open at 7 a.m. during weekdays, so then they can come back if they're needing to wait there till the bus shows up.
Okay.
So yeah, now we open at 5 p.m. We just kept that open. They start intaking, processing them in, and then they stay there, get a warm meal, some snacks, and then by 7 they can leave the expansion. What's good now that it's year round is as they sober up, instead of kicking them out in the summer at 2 a.m., we can shift them to the back, and they can sleep there until the morning.
And the JIP program, Joint Intervention Program, I'm going to call it JIP on the rest of the way through here. JIP is different. It's designed to bring individuals out of the sobering center and encourage them to get into programming. Is that right?
Yes.
Talk about that.
So it was brought together. It was the City of Farmington, San Juan Regional Medical Center, San Juan County, and Presbyterian Medical Services came in, named it Joint Intervention Program. And we wanted to help those that are high utilizers of services. Stays at the sobering center, days at the detention center, negative contact with law enforcement, getting arrested.
Nights in the ER.
Yep, nights in the ER, or fire being dispatched and having to go help them out. So it was those individuals that the program was started for. So we want to encourage them to get into the Joint Intervention Program. So they can walk in or they can get court ordered. We do, but most of them are referrals from other programs that we work with within the county. It's a year-long program. It is outpatient. A lot of people think it's inpatient, but it's outpatient. It's intensive. We do 6 months treatment and 6 months of aftercare. Phase 1 is the first 3 months, and phase 2 is 2 months, and then the last phase is 1 month. And then they have the option to stay to additional 6 months for the aftercare.
So you say it's outpatient. So, I mean, the program typically runs Monday through Friday, 8 to 5, and then in the evening times they're kind of on their own?
Yes, that's correct. So I refer to it as kind of open campus, like you would with schools. So they can stay there. They do check-in like at 8:15. The first phase, as I mentioned, it's pretty intensive. You're doing 2 groups a day. You're doing check-in, you're doing check-out. We have CSWs, where they're community service workers that do case management. They meet with them 3 times a week. Everybody's assigned a therapist or counselor, and they do one-on-ones once a week.
Okay.
We've also initiated recently NA groups, AA groups. Part of JIP is getting them connected with the community. You come through the treatment, you graduate it, what now, right? So plug them into the community. Hey, you already know where AA meets, NA, you got those connections. And then not only is Totah there to help, but now we have other individuals that are there to help as well. Part of JIP is also getting them a PCP, primary care provider, which helps with the ER visits, right? A lot of them are like, I need to get seen, I need to go to the ER. It's like, well, we can do walk-ins. It doesn't have to be the clinic. Do you have a provider? We can take you there. So getting connected with their doctor and getting used to setting appointments and getting seen regularly, because some don't go, until something's going on, and then it's usually the emergency room.
Right. For those who in the first 3 months, well, I mean, the whole thing, so the first 6 months is outpatient, The next 6 months, is there some transitional living component to that?
So the other goal is try to get them housed. Not everybody is homeless. Some do have family.
Right.
But if they want an apartment or needing, then we connect and we work with a few individuals in town. The path, if we need to transition them there. We work with a navigation center. San Juan County Partnership is a huge part of the housing component.
Sure.
So we want to see which program or they can work under to get them housed.
Okay.
So while they're waiting, the goal is during aftercares, you're waiting for the housing. So that way, when you've completed the program, you're on your own. They do their own cleaning, they do their own cooking. So part of that is getting them ready for that, preparing their meals, cleaning the house.
Doing their laundry.
Doing the laundry, yeah. They do their own laundry. We have the laundry room at Paul's Place, which is the name of the dorm, and they have chores they complete every day.
We'll talk about Paul's Place. So what role does Paul's Place play, and how many beds are in Paul's Place?
So Paul's Place is a dorm. Initially, as you mentioned, the pilot program that was not there, and then it came later on. Well, so they don't have to stay in the dorm to be in the program, but you need to be in the program to stay in the dorm. We can house 38 individuals, 30 males and 8 females currently. So part of it just living, adjusting. It's their home. We try to keep it safe. We do BACs, random UAs. The staff does searches. So a lot of it, again, like I said, it's keeping it safe. They have somewhere to stay, and it's on campus. So they don't need a ride to come to the classes. They don't need a ride to come for the groups. Everything is on campus. It's just walking across.
No, it's great. And I know we've got slated spot there for a food truck, and there's going to be some additional another building put in by the county for their mental health crisis center.
Correct.
So all that's kind of working together on that end to address a wide array of issues that we're seeing across, certainly not just our community, but across the world.
Yes.
On a typical, I guess this, how many beds, because I get this question a lot from individuals, they'll see somebody on the street at night and, how come we don't have beds for these folks? And the fact is the shelter does have beds
That's
for these
correct.
folks. So
Yep.
talk a little bit about that.
We can max out at 82, and even if we had more, we'd make room somehow, because our goal is not to turn anyone away.
Have we ever had to turn anybody away?
No.
Have we ever been over capacity?
We have not.
That's a,
Yeah.
yeah.
So we take them in, and a lot of people sometimes don't come because we do take property. We don't have the room for it in the back. Obviously, again, keeping it safe. We don't know what's in the bags or what they may bring in, whether it's
Right.
drugs or other things. Sometimes people come in the sobering center to recruit people. So they stash alcohol. They come in. They're like, hey, we got alcohol outside. So then they leave because it is voluntary.
Yeah.
We don't make them stay. So, just trying to keep an eye on that, bringing them in and just helping them. We house the males and the females. If we get too many males, we can move them to the female side and move the females up front if we need to. And then we got some rooms the single rooms that we can use as well.
And how long can somebody stay at Paul's Place?
At Paul's Place, we try to keep them under 2 years. But last year we had an individual there had been there about 11 months, had just graduated the 6-month treatment.
Okay.
So as they move up in phases, the clinical team gets together and then we meet with them. Are you meeting the requirements? You're doing what you're doing. Have you had relapses? Because sometimes, that happens in treatment, which is why we're also fortunate sobering centers there, because then they can stay on campus. We try to keep them there because once they leave, it's so hard to get them back
Right.
into services. So our goal is to make sure that they're ready for the next phase. So that's why they have the CSW to ensure they're helping them along the way. Do you have questions? They're meeting with their therapist. We want them to also advocate for themselves. What do you need help? What are you needing? We have a donation room in the sobering center, a donation room in the outpatient building. We always take donations as far as clothing.
I was going to ask, so if somebody's interested in donating, kind of what can they donate?
So we only offer services for adults. So sizes that'll fit adults. Bring them to the outpatient building, that Totah, and then we usually screen them and then put them in the rooms. Usually we can't take food just because we're under regulations, or sometimes it's expired. We can't serve that there. So,
Right.
yeah, we get weekly deliveries from services, and that's how we have a kitchen where they prepare the meals. It's inspected. We got to follow all that. So
Sure.
we got to make sure that, although some people want to give food, we can't take some of that. But
Well, there's other places they can do that. And there's
Yes,
plenty
that's
of places
correct.
taking food. And give the address on Ojo Court, and I guess describe it. I mean, many people don't know that it's off the Bistai Highway, right on the south side of the road. And what's the address there?
1615 Ojo Court.
1615.
Yeah, it's right next to the RC.
I was going to say, and right next to it is the RC Park for cars or for airplanes. Really beautiful setting down there. What is our typical, annually, how many people do we see through all those programs?
I think we hit about 93 in the joint intervention program that came for services.
Okay.
Some come and go, some stay. So that's what our number was
For last year?
25.
Okay.
I want to say 12,000 for the sobering center.
12,000. But not unique. Those aren't
No,
unique.
those
are
aren't
just
unique.
number of
came in.
visits.
Yes, that's
Okay.
correct. So it's sometimes the same people for both sides, but we're there to help them out.
If someone's on drugs, are they allowed to go to the sobering center?
They can, and we,
Okay.
we take them. We usually keep them separate just because it's a different than alcohol,
Substance,
obviously.
yeah.
Especially when withdrawals, if they have to. So everybody that comes in, as you mentioned earlier, gets screened. We do vitos. We have certain parameters they got to fall within, and if they're too high or too low, then we call 911 and get EMS services out there.
The partnership component, I think, is really important. I don't know if it's unique. I'm sure in other communities they have it, but you've got city, county, hospital, PMS. They're all in it together. Did I miss one in there? It seems.
I think that was already.
Yeah, and they're all contributing money and they're contributing resources to this effort, and it's a serious situation. I was reading recently an article from 1974, and it was almost like reading current history now. Just the alcohol abuse issue that we face in this community, the uniqueness of where we're located. All those components go into it, and there's not a real good answer for it. So what we've been trying to throw at it is resources and money, and trying to find the best scenario of getting people to where you can bring the horse to water, but you can't make them drink, kind of thing. But I think in this center and the way that we're kind of loving on these folks, are we seeing success in that way? Are we seeing people who maybe the first couple times, they don't stay in the program, but the third time it sticks?
And we are. Actually, I was sharing earlier with Greg. I had a gentleman who just graduated last Friday. This is his fourth time in JIP since I've been there.
Oh, wow.
And he had never gotten past phase 2. So right now he's actually looking at getting housed, hopefully within the next month, and then moved in. A female last week got housed in the apartment. She was actually staying in the expansion, got plugged into services, was seeing a therapist, got a CSW, and was doing case management. And now she moved in last week. So
That's
slowly,
great.
and those partnerships are important, because we need help. It's just not, it's kind of it takes a village.
It really does.
Yeah, it does. And maybe we are unique, but we've had people, I think it was last year, Christine was asked to present to city council in, I want to say Hidalgo down south somewhere.
Okay.
Because they liked what we had, and we're trying to get them on board on, this is what we can accomplish, or get started at least, and see if that works for us.
Do you know if McKinley County or Gallup have anything like what we're doing?
I don't think so.
Okay.
I think we're the only ones.
Do we
that
get
have
referrals
this.
from that area as well?
We have
Yeah.
gotten some from out there. It's been a couple of years, but we're also working with Navajo probation as well out of the Shiprock area.
Okay. Interesting. Well, I think it's such a huge regional resource. And I speak, very, very proudly of the fact that we've got such a great network of agencies that are working on not just this social issue, but so many that are kind of, centered around addiction or mental health and abuse and all those kind of things. And, we have these resource summits that San Juan Safe Community puts on a couple times a year. There's one coming up in the spring that I want to make sure people know about, and you can find that information on the San Juan Safe Community website. But in that resource summit, these partners talk about what they do and how they do it and how you can access it. And it's important that everybody kind of share this information so that we're all aware, because I think, as you had mentioned earlier, you don't want to be in a position to turn somebody away. You're not going to turn somebody away if they come to you. The same thing with these partners that we work with citywide. We don't want to say no, and we don't want a partner to say no. We want them to say, let us help you. Let us help you find what you're looking for. If we can't do it here, we're going to find somewhere where somebody can. And I see a lot of that happening out, on our campus of care. So I know we've just added a new component to this as well, which we want to talk about the mobile crisis unit. So
mobile crisis was started mid last year. It's through PMS. It functions out of the clinic, Farmington Community Health Center. And of course, they partner with us because we sometimes work with the same people. Starting next week, I think we're going to start having some of their peers supports come in for swing shift and graveyards, and their role is just to plug in, make connections with people staying at the expansion.
Okay.
More so because they're sober. That's why they're not hanging out in the sobering center. But we want them to connect with them, see familiar faces, because if that individual's going into crisis, they're more likely to adhere to what we're having or help them if they
know
already
the
have that connection.
Yeah.
Correct. So that's really new. As I say, we're starting next week, and if you go into a crisis and you need a contact mobile crisis, you can call 911 or 988, and they will reach out to them.
Where does 988 go? Does it go directly to that center to dispatch a mobile crisis unit? I mean,
and now they
not
know
familiar with
because
988
it's here. So, we can. If you're needing the help, right? We have 911 for break-ins and everything else, and people don't know. Some people still don't. 988's there if you need for mental health resources.
Oh yeah, good to know.
So that helps there. We're there to help as well. So it was started just for that, and basically, I believe dispatch will take the call, give the information. The therapist and the peer that's going out will either go out, or if needed, then they contact law enforcement, just depending on the situation.
Okay. So this is kind of, you've seen some of these models discussed. I think this probably started back in 2020, where became a lot of questions about types of calls police officers are going to, and is it better to send a therapist instead? So this is kind of one of those situations. There's an option for folks.
That's
so
correct,
that mobile crisis unit has. It's a licensed therapist, obviously, who's been trained in these kind of situations, and then they go and assess and see what's going on, and if law enforcement's needed, they would call them in.
Yes, that's correct. And that's our role with a lot of things, even with the joint intervention program. It started so that law enforcement can deal with the crime and not the individuals that are needing help.
Right.
ARU, same thing started. They get called and dispatched, and then they screen the individual. And if needed, law enforcement and or paramedics will be notified. This, again, gives us another tool, and if needed, then they'll dispatch law enforcement to help out.
No, it's great. It's great that we have those resources and ability to then not have to dispatch, because in a typical situation 10 years ago, before we had ARU, if somebody was a down subject, you had a fire truck show up, an ambulance show up, and a police officer show up. And now the ARU is able to deal with that. So that's unique. So mobile crisis unit, 988 is the number to call if you have a situation like that. I do want to throw out there too, 211, if people are looking for help and resources from our other social service providers. 211 is another shortcut. A lot of these things people don't know, but again, check out what's going on in the kind of the health resource summit that we're going to be having here soon. I encourage people to attend that and share that information. So mobile crisis unit is new. We have the crisis center that's being put out there at the campus of care.
Yeah, the crisis triage center.
Crisis triage center. Kind of a similar situation. Somebody comes in, they're going to assess them, figure out what it is they need. Mm-hmm. And are there any other programs or anything else that's kind of coming into this campus?
Those are the most recent ones.
Okay.
And again, the crisis triage, same thing is, the hospitals get overwhelmed with patients that are needing different kind of care. So that's what that's there for as well. I believe they're looking at combining it and the sobering center, hopefully in one building, to kind of help that as well.
Well, it's fun. I'm glad you came on the show. I appreciate Christine Carlson as well, who's I think we've had her on before to talk about some of these things. If people wanted to get more information about what you all do, what would you recommend?
Well, they can come by the campus. I know the Navigation Center helps a lot with what resources are available in San Juan County. PMS.org has a lot of our information. PMS itself not only has behavioral health, we have medical, dental assistance if needed, housing, that's a component that we have. So, we just try to work together with our partners and to better help, those that are in the community. Some would say you see these guys drunk at the bus stop, and it's like they're still part of the community.
Yeah.
It's like, let's help them get on their feet. Let's help them get those resources that they're needing. The other good thing with PMS, if you don't have money, they'll still see you. They have sliding fee scales, other ways. We try to get Medicaid, Medicare. We don't, again, not just the Sobering Center, but any other services, we don't want to turn people away.
Right.
So we try to help where we can, as much as we can.
No, it takes a village. You said it earlier. And I know we really do have to have some compassion for these individuals and understand the situation that they're in and how they got in that situation. You don't know.
Right.
I mean, their story, their journey is probably very different than what you think it is. And so I really appreciate the work that you all are doing out there and all of our network of care throughout the city. And people need help. We got to have services that are there to try and lift them up and get them back on the street and build pride back into them so that they can go be a part of this beautiful community that we have. Anything we didn't leave, anything we didn't cover that you want to make sure we touch on?
I think we covered everything. I just want to thank the city again, because obviously we can't do that without support.
Sure.
Everybody needs help, and it's just coming together and helping each other out, and then see what we can do for those individuals. But thank you and the city and everybody else that contributes, and just wants to see our area improve and help those that are needing it.
No, absolutely. And it's I love this place that we live in, whether it's the city, it's the county. I feel like everybody's rowing in the same direction, that we want positive outcomes for each person in this community and opportunities for them to have a great life. And but again, everybody's journey is different.
Yes.
And that's why we have these safety nets there for them. So, well, Estevan, thank you for being here. Thank you for joining us today. I hope you share this information with people in your family, your friends, your neighbors. Let them know what your community is doing to address the issues that we're facing as a society as it deals with addiction and mental health. So we're doing a lot of good things. If you would like to donate clothes, please, adult-sized clothes can go to Ojo Court, 1615 Ojo Court, and take it to the Totah Behavioral side. Is that correct?
The outpatient building.
The outpatient building. And so you can be a part of that solution, trying to help those who are in need. So thank you again, Estevan, and thank you for being here. We'll see you here next time on the Mayor's Table.